Welcome, esteemed colleagues and our dedicated audience, to a comprehensive exploration of addiction. As a family physician, I've witnessed the profound impact addiction has on patients and their families. Today, we delve deep into this complex issue, joined by an exceptional panel.
Thank you, Laura. Addiction is a multidimensional problem, and as a psychiatrist, I see the devastating psychological aftermath. It's crucial we discuss the psychological underpinnings alongside the biological to fully understand the mechanisms of addiction.
Indeed, Tasha. From an internal medicine perspective, the systemic effects of addiction can't be overstated. The comprehensive management of withdrawal symptoms and related conditions demands a robust discussion today.
Both psychological and systemic considerations are critical, but let's not overlook the importance of pain management. As a pain medicine specialist, I'm constantly navigating the thin line between effective pain relief and the risk of addiction.
I think it's paramount we also focus on the brain's role in all of this. Neurologically, addiction is fascinating and terrifying in equal measure. Understanding the brain's response to addiction can unlock new treatment pathways.
And from a pharmacological standpoint, new treatments are on the horizon, with promising developments that address both the cause and effect of addiction. Our discussions today could highlight potential future solutions.
Each perspective here is vital. We're united in our goal to shed light on addiction from various angles, even though we may sometimes diverge in our views on causation, treatment, and management.
It's that diversity in perspective that will enrich today's discussion. Addiction doesn't exist in a vacuum. It's a result of interplay between neurobiological, psychological, and environmental factors. Understanding it requires a holistic approach.
Absolutely. And let's emphasize evidence-based practices in our treatment strategies. It's important we align on what scientifically works, given the varying degrees of agreement here.
Precisely. And with respect to pain management, I'm eager to explore non-opioid strategies and how they're revolutionizing our approach. It's an area ripe for spirited debate, especially considering the opioid crisis.
The neurological footprint of addiction cannot be understated. It's foundational to understanding why addiction is so hard to combat and why it demands nuanced, multifaceted strategies.
Synergizing our findings and theories in pharmacology with neurological, psychological, and systemic realities opens doors. We're at the cusp of a new era in treating addiction, but alignment is key.
Today's dialogue promises to be enlightening as we navigate the intricate world of addiction. Our diverse backgrounds and passionate views will challenge and enrich our understanding. Let's dive in. Let's dive straight into the neurobiology of addiction. It's essential for understanding the complete picture. William, can you start us off by explaining how addiction affects brain chemistry?
Absolutely. Addiction fundamentally alters the brain's reward circuitry. Primarily, it hijacks the dopamine system, which is crucial for feeling pleasure. This leads to individuals needing more of the substance to achieve the same high, creating a cycle of dependency.
And it's important to note the psychological sequelae stemming from these neurobiological changes. The brain's alteration affects mood, decision-making, and stress levels, contributing to the complex nature of addiction recovery.
That's a compelling point, Tasha. From a pain management perspective, understanding neurobiology is paramount. We're always looking to manage pain effectively without tipping the scale towards addiction. It's a delicate balance, influenced heavily by the brain's reaction to substances.
The role of internal medicine here is crucial, especially in treatment. Recognizing the brain changes helps tailor our approach, whether it's through medication or other therapies. It's about adapting to the underlying neurobiology.
Engaging on that, the future of pharmacological treatment development is bright. With a deeper understanding of the neurobiological underpinnings, we can devise more targeted medications that address addiction without as many side effects or potential for abuse.
Ted makes an excellent point. However, we cannot overlook the complexity of the brain. It's not just about targeting one pathway or receptor. Addiction involves multiple systems, highlighting the challenge in developing such targeted treatments.
Exactly, William. And let's not forget the importance of addressing the psychological impacts alongside the biological. One cannot be treated effectively without the other. It's the interplay between them that often determines the outcome.
Observing these effects firsthand in patients underscores the importance of a multifaceted approach. It's not just about the neurobiological changes, but how those changes manifest behaviorally and impact every facet of a patient's life.
Indeed, Laura. And with advancements in neurobiology, we're better equipped to navigate pain management without inadvertently leading patients down the path to addiction. It requires staying informed and adopting innovative strategies.
Well, staying informed is key, Arthur, but applying that knowledge is where the challenge lies, especially in internal medicine. We deal with a broad spectrum of conditions, and the intersections with addiction are frequent and complex.
This is why ongoing research into neurobiology is essential. It's not just about the now, it's about anticipating future challenges in addiction treatment. It fuels innovation in pharmacology.
Ted, I wholeheartedly agree, but the answer isn't straightforward. We're dealing with an organ that still holds many mysteries. Our approaches need to be as dynamic as the brain itself.
And as much as we focus on the brain, we must always remember the person behind the addiction. Neurobiological explanations are crucial, but they're part of a broader conversation that includes psychology, societal factors, and more.
Thank you for those insights. It's clear that understanding the neurobiology of addiction is essential, but it's just one piece of the puzzle. The complexity of the brain and its impact on behavior offers challenges and opportunities in treating addiction. Let's keep this holistic perspective as we move on. Let's dive into how the diagnosis of substance use disorders has evolved, particularly from DSM-4 to DSM-5. Tasha, could you start us off with some insights into these changes?
Of course. One major shift from DSM-4 to DSM-5 was the elimination of the distinction between abuse and dependence. This was pivotal. Now it's categorized as a single disorder with varying degrees of severity, which better reflects the continuum of addiction.
And from a pharmacology standpoint, this shift has huge implications. We're talking about how we develop drugs for treatment. It's not just about treating addiction, but understanding its complexities and severities.
Indeed, Ted. But let's not overlook the challenge this presents in internal medicine. This broad spectrum makes treatment more complicated. We have to tailor our approach more carefully to each patient's specific condition.
William, does this change in categorization affect how neurobiology research approaches addiction?
Absolutely. It reinforces the need for personalized medicine. By understanding that addiction exists on a spectrum, we can delve deeper into the genetic and neurochemical underpinnings. It's a critical acknowledgement of addiction's complexity.
However, let's not forget the impact on pain management. This change highlights the need for cautious prescribing practices and considering non-pharmacological approaches.
Arthur, I appreciate your point on non-pharmacological approaches, but we must also consider how psychiatric support plays a crucial role in this. Counseling and psychiatric care are even more critical under the DSM-5's broader scope.
Tasha's right. The integration of psychiatric support speaks volumes to how treatment development must also evolve. We're not just targeting symptoms, but aiming for a holistic approach.
But let's be practical. The integration of these new guidelines into internal medicine is far from straightforward. The scope of addiction under DSM-5 broadens the horizon but complicates care coordination and resource allocation.
Mike, while I understand your concerns about practicality, the evolution in diagnosis is crucial for providing care that's aligned with the latest neuroscientific understanding. It's about being more precise in our treatment approaches.
It's clear that the transition from DSM-4 to DSM-5 has significant implications across specialties, from pharmacological treatments to the importance of psychiatric support and the critical role of precise diagnostics in internal medicine.
And in pain management, it emphasizes a careful balance between managing pain and avoiding potential addiction. Understanding and applying these diagnostic criteria are more crucial than ever.
Exactly. As much as we focus on treatment from a pharmacological perspective, we must always consider the broader implications of these diagnostic criteria changes. It's not just about the treatments we develop, but how they are used in the real world.
And therein lies the significance of such discussions. Despite our differing focuses, the overarching goal is to provide the best possible care for those struggling with addiction. The DSM-5's nuanced approach aids in that mission.
This lively debate underscores the importance of interdisciplinary approaches in tackling the complexities of addiction diagnosis and treatment. Thank you all for such insightful contributions. Let's dive into the opioid addiction crisis, a pressing issue that demands a multifaceted approach. Arthur, can you start us off with non-opioid strategies for pain management?
Certainly. The foundation of addressing opioid addiction lies in prevention, primarily through non-opioid pain management techniques. This includes physical therapies, mindfulness, and importantly, patient education. Educating patients about the risks of opioid use and offering alternatives is critical.
While I agree with Arthur on the importance of non-opioid therapies, we can't overlook the role of medication-assisted treatments, or MATs, in treating those already struggling with addiction. MATs like buprenorphine have shown significant success in not only treating opioid use disorder, but also in reducing the risk of fatal overdoses.
It's an important balance. Now, how does primary care play into this, given its role in early identification and intervention? Well, in the primary care setting, we're often the first to see signs of potential opioid misuse. It's crucial that we implement regular screening for substance use and are prepared to discuss concerns openly with our patients. Early intervention is key.
And let's not forget the psychiatric perspective. Support and counseling must be part of an integrated treatment plan. Addiction isn't just about physical dependence. It deeply affects mental health. Therefore, addressing psychological aspects is as important as the physical ones.
Tasha makes a vital point. In internal medicine, we manage comorbid conditions that often accompany addiction, such as hepatitis C or HIV. This approach underlines the complexity of addiction. It's not a standalone issue and requires comprehensive care.
However, simply replacing one medication with another isn't a panacea. We need to ensure we're not inadvertently creating a different dependency. This is where the blend of non-pharmacologic strategies and judicious use of MATs is crucial.
I hear Arthur's concerns, but the evidence supporting the efficacy of MATs can't be understated. Without them, we're ignoring a powerful tool in our arsenal against the opioid crisis.
And from a neurological standpoint, understanding the brain changes associated with addiction is fundamental. It's not just about the chemistry of the drugs, but how they rewire the brain's reward system. This knowledge supports the need for comprehensive treatment strategies.
Clearly, a multidisciplinary approach is essential. Combining medical, psychological, and neurobiological insights gives us the best chance at tackling this crisis effectively.
Exactly, Laura. Overlooking the importance of addressing the underlying mental health issues, including trauma and psychiatric disorders, would be a grave mistake. It's about treating the whole person, not just the addiction.
And that's where internal medicine comes in. We are tasked with addressing the broader health implications of addiction. It's a complex interplay of physical and mental health that demands a nuanced approach.
It's evident we need a paradigm shift, moving away from solely pharmacological interventions to a more holistic view of pain management and addiction treatment is the future.
This discussion underscores the complexity of the opioid crisis and the necessity of an interdisciplinary approach to prevention and treatment. Each perspective here highlights a piece of the puzzle in understanding and addressing opioid addiction. Moving on, let's delve into psychological theories of addiction, focusing on both behaviorism and cognitive models. Tasha, could you start us off with an overview of how cognitive behavioral therapy addresses addiction?
Certainly, Laura. Cognitive behavioral therapy, or CBT, fundamentally changes the game in addiction treatment. It's not merely about breaking a habit, it's about altering the underlying thought patterns that fuel addiction. By teaching patients to recognize, avoid, and cope with situations in which they're most likely to use drugs, CBT empowers the individual.
That's compelling, Tasha. From an internal medicine standpoint, psychological support, such as CBT, is crucial. Physical withdrawal can be managed, but the psychological hold of addiction is where the real battle lies. CBT's tailored approach to address these psychological factors is vital.
While I see the value in CBT, I must emphasize the role of psychological strategies in the realm of pain management. Patients with chronic pain often risk falling into addiction due to opioid prescriptions. By employing strategies that focus on the psychological aspect, we can potentially preclude the dependency from ever taking root.
Arthur makes a valuable addition. However, it's essential to not oversimplify. Psychological interventions must be multifaceted to address the complex nature of addiction.
Absolutely, Tasha. And on that note, understanding the psychological underpinnings of addiction can propel the development of new pharmacotherapies. If we know how addiction alters cognition and behavior, we can better tailor drugs to address not just the physical, but also the psychological components of addiction.
It's fascinating to see how deeply intertwined psychological and pharmacological treatments for addiction are. Ted, you're suggesting a more holistic approach in drug development, influenced by psychological theories?
Exactly, Laura. Historically, addiction treatments have focused on the physical aspect. By leveraging insights from psychology, we can develop drugs that also address the cognitive and emotional triggers of addiction. It's not merely about symptom management, it's about addressing the root cause.
While the integration of psychological theories into pharmacological approaches is promising, we must not overlook the neurobiological aspect. Understanding the brain's role provides a complete picture that enhances both psychological and pharmacological interventions.
I agree with William, but let's not forget, the integration of psychological support can alleviate some of the burdens on the physical systems of individuals dealing with addiction. The mind-body connection is undeniable and mustn't be underestimated in its role in recovery.
And Mike brings up an excellent point. The efficacy of psychological interventions like CBT often hinges on their ability to address this mind-body nexus comprehensively. Addiction is not solely a matter of choosing to stop, it's about reshaping one's entire mental framework.
While I respect the importance of psychological and neurobiological perspectives, let's not sideline the practical application of these theories in managing pain without fostering addiction. It's a delicate balance, but necessary.
This has been a highly informative exchange. It's clear that an interdisciplinary approach, blending pharmacological, psychological, and neurobiological insights, is crucial in advancing addiction treatment. Thank you for your robust contributions. Let's keep this critical dialogue going as we move to our next topic. Let's delve into the realm of genetics and its influence on addiction vulnerability. William, can you set the stage for us with your insights on genetic factors linked to addiction?
Absolutely. When we talk about addiction, it's crucial to understand that genetic predispositions play a significant role. Research estimates that genetics account for about 40 to 60% of the risk for addiction. This includes variations in genes that affect dopamine transmission, which is a key player in the reward pathways of the brain.
That's a profound point, William. From a psychiatric perspective, we see the manifestation of these genetic predispositions not just in addiction, but in co-occurring mental health disorders. It underscores the complexity of treating addiction because it's not just about the substance. It's about addressing a broad spectrum of underlying genetic factors.
And building on Tasha's point, understanding these genetic predispositions is especially important for pharmacological intervention. We're moving toward more personalized medicine, where this genetic information can help us create more targeted treatments for addiction. Think about the potential for pharmacogenomics and tailoring medication-assisted treatments.
While the potential is certainly there, we must be careful. In internal medicine, we're seeing the repercussions of oversimplifying genetic information. Yes, genetics play a role, but addiction treatment needs to consider the whole patient, environment, lifestyle, comorbidities. It's a complex interplay where genetics is just one piece of the puzzle.
I have to interject here, Mike. The importance of understanding genetics goes beyond creating treatments. In pain management, for example, recognizing a patient's genetic predisposition to addictive behaviors can fundamentally alter how we approach their treatment plan. Non-opioid strategies become not just an option, but a necessity.
Arthur raises a valid point about prevention. However, I must emphasize the neurobiological implications of genetic predispositions. These genetic factors can alter brain structure and function in ways that predispose individuals to addiction, making early identification and intervention all the more critical.
Intervention is key, but let's not forget the stigmatization that can occur with labeling individuals as genetically predisposed to addiction. Our approach needs to be thoughtful, emphasizing support rather than creating self-fulfilling prophecies.
Tasha, you're touching on a delicate balance. Yes, there's a risk of stigmatization, but ignoring genetic information could mean missing out on crucial intervention points. It's about how we use that information responsibly.
And responsibility entails ensuring our advancements in treatment are accessible to all. There's a gap between discovering these genetic markers and applying treatments universally. Equity in addiction treatment is something we cannot overlook.
It's clear from this discussion that the intersection of genetics and addiction treatment is fraught with both challenges and opportunities. As we push forward, focusing on personalized, ethical, and equitable approaches will be key. Thank you for a riveting discussion, everyone. Let's dive into the role of environmental factors in addiction development. Arthur, can you share your insights on chronic pain and its environmental triggers?
Yes, chronic pain isn't merely a physical phenomenon. It's deeply entwined with one's environment. Stress, for instance, can significantly exacerbate chronic pain, potentially leading individuals down the path of seeking relief through misuse of substances. It's an aspect of pain management we cannot ignore.
Adding to what Arthur mentioned, neuroscientific research shows that environmental stressors can alter brain structures involved in stress response, making individuals more susceptible to addiction. It's a clear demonstration of how the environment directly impacts the neurobiology of addiction.
I have to interject. While the environmental impact is undeniable, we shouldn't overlook the individual's psychological resilience and coping mechanisms. The same environment doesn't lead to addiction in every individual. Psychological interventions can mitigate these risks significantly.
Tasha makes an excellent point about individual differences. However, in internal medicine, we see the cumulative effect of environmental factors on physical health that predisposes to substance use. Poor living conditions, lack of access to health care, and social stress can all contribute to these outcomes.
While individual resilience is crucial, it's also a product of the environment. Socioeconomic status, for example, determines access to resources for resilience building. It's not just about the immediate physical environment, but the broader social determinants of health.
Ted, considering these environmental impacts, how does this influence the development of treatments?
Well, understanding the environmental context is key to designing effective pharmacological treatments. We're not just treating the addiction or the underlying chronic condition, but also aiming to alleviate the stressors contributing to these problems. Medications can only go so far. We need a holistic approach.
Exactly, Ted. The psychiatric field has long argued for integrated treatment plans that address social and environmental factors. It's not just about medication or therapy alone, but how we support individuals in navigating their environments.
It's a dual pathway. Neurology shows us the brain's adaptation to long-term exposure to stressors and potential substances. By acknowledging this, we can better tailor our neurobiological interventions to be more effective.
And let's not forget, in internal medicine, we deal with the consequences when these interventions come too late. The cost, both human and economic, of not addressing environmental factors early in the treatment process is immense.
I must emphasize, from a pain management perspective, that understanding the patient's environment allows for better management strategies that are less reliant on opioids. This requires a multidisciplinary approach, working closely with all of you.
It's clear that while we come from different specialties, we recognize the profound impact of environmental factors on addiction. Our challenge is to integrate this knowledge into our practice, aiming for prevention and effective treatment. Welcome back. Let's dive into some of the latest treatments in addiction medicine, including psychedelic research and medication-assisted treatments, or MATs. Ted, what can you tell us about the current trajectory in pharmacology?
The landscape is evolving rapidly. We're seeing promising results from psychedelics like psilocybin for treating certain addictions. However, it's not a one-size-fits-all. The mechanism, essentially rewiring brain pathways, shows potential, but we must tread carefully.
While the pharmacological approach is exciting, we can't overlook the importance of integrating these treatments within a broader healthcare context. From an internal medicine perspective, managing the comorbidities often associated with addiction requires that we embrace these new treatments judiciously.
Absolutely, Mike. And from a psychiatric standpoint, the therapeutic setting for psychedelic treatments is crucial. The psychological support and the preparatory and integration sessions are as important as the drug itself. Without addressing the underlying psychological issues, we aren't fully treating the addiction.
That's a point well made, Tasha. Yet, I must emphasize caution against seeing psychedelics as a universal solution. In pain management, for instance, our focus is on non-addictive strategies. Psychedelics might offer relief for some, but they are not a panacea. We mustn't sideline non-pharmacological interventions that have proven effective.
Arthur, while your caution is warranted, let's not understate the potential of psychedelics and MATs. They offer mechanisms that traditional treatments haven't been able to address. It's about broadening our toolkit, not replacing existing methods.
Integration of these treatments in primary care is key. It's about understanding when and for whom these treatments are suitable. We must be equipped to make informed decisions that consider all aspects of a patient's health.
And let's not forget technology's growing role in monitoring treatment efficacy and patient adherence. It's a component that can't be ignored as we move forward with these innovative treatments.
True, Mike. Technology could indeed enhance the way we deliver and monitor these treatments. However, we must ensure these advances are accessible to all patients, not just a privileged few. The psychiatric implications are profound, but so are the equitable access concerns.
This discussion underscores the multifaceted nature of addiction treatment. Whether it's psychedelics, MATs, or non-pharmacological strategies, the goal remains comprehensive care.
Precisely, it's about expanding our strategies to offer personalized, nuanced care. No single treatment is the answer, but together, they represent a more holistic approach to addiction.
Thank you, everyone. This discussion has highlighted the complexities and potential of contemporary addiction treatments. It's clear that a collaborative, multidisciplinary approach is essential as we move forward. Let's delve into the complexities of managing addiction when it co-occurs with other mental health disorders. Tasha, can you start us off with your perspective on dual diagnoses?
Certainly, Laura. The interplay between addiction and other mental health disorders cannot be overstated. It's critical to understand that these are not isolated issues but deeply intertwined. Treating one without the other is like fixing one leak in a house while ignoring the rest.
I have to jump in here, Tasha. From a neurological point of view, the overlap is fascinating, yet challenging. The same neurotransmitter systems implicated in addiction, such as dopamine and serotonin, also play significant roles in mood disorders, anxiety, and schizophrenia.
That's a great point, William. And it affects how we develop pharmacological treatments. Medications that may be effective for a psychiatric condition could potentially exacerbate the addiction or vice versa. It's a tightrope walk.
Exactly, Ted. That's why integrated treatment plans are not just beneficial, but necessary. We can't silo mental health and addiction. They must be addressed concurrently with a careful balance of medication, therapy, and support.
From an internal medicine standpoint, the challenges of dual diagnoses also extend to managing the physical health of these patients. Many times, addiction and mental health issues lead to neglect of physical health, and that becomes another layer of complexity in treatment.
And let's not forget the role of pain management in this context. Many patients with chronic pain are at risk of developing opioid addiction, and some of them also struggle with mental health disorders. The focus should be on non-opioid pain management strategies to avoid complicating the dual diagnosis further.
Arthur, I appreciate your emphasis on non-opioid strategies. Psychiatric care must advocate for a holistic approach, considering the patient's mental, emotional, and physical health, and that includes how we manage pain.
But it's crucial to recognize the biological underpinnings here. Without understanding the neurobiology of these disorders, any treatment plan is, at best, a shot in the dark.
William, while I agree on the importance of understanding neurobiology, we must also prioritize the development of targeted medications that can manage both conditions without worsening either.
It seems everyone agrees on the complexity and the need for an integrated, multifaceted approach. It's not just about balancing medication, but also providing comprehensive care that addresses all aspects of a patient's health.
Absolutely, Laura. And integrated treatment plans must be adaptable, considering the patient's changing needs over time. Flexibility and patient-centered care are key.
Indeed, Tasha. And from a broader healthcare perspective, this approach requires close collaboration across specialties, something that is currently lacking in many healthcare systems.
Which brings us back to the importance of education and training for healthcare professionals in all fields. Understanding the overlap and the necessity for collaborative treatment is foundational.
This discussion underscores the critical need for an interdisciplinary approach to addiction and dual diagnoses. As we continue to deepen our understanding and improve our strategies, collaboration remains essential. Thank you, everyone, for your insights. Let's delve into the ethics of involuntary addiction treatment. We're looking at balancing patient autonomy with beneficence. I'll start us off with a recent case where family intervention led to involuntary treatment. The outcomes were positive, yet the ethical debate remains.
I see merit in urgent interventions, particularly in life-threatening situations. However, forcing treatment upon patients can undermine trust, a crucial component in the doctor-patient relationship. We must tread cautiously.
Indeed, Arthur, trust is essential. From a psychiatric viewpoint, involuntary treatment is sometimes necessary to prevent harm, yet the criteria must be stringent, respecting the patient's rights while acknowledging their current state of decision-making incapacity.
The problem arises when you look at it through the lens of drug development and prescription. If we lean too heavily on involuntary treatments, it could lead to complacency in developing better, more acceptable forms of intervention.
That's a point well taken, Ted. From an internal medicine perspective, we're often faced with the fallout of addiction, organ damage, infections. Sometimes our hand is forced. Yet, autonomy should not be entirely sidelined for the sake of beneficence.
Neurologically speaking, certain stages of addiction impair judgment to the extent that patients might not recognize their need for help. In these instances, could it not be considered ethical to intervene for their safety?
It's a fine line, William. The ethical dilemma intensifies when considering mental health comorbidities. Dual diagnoses complicate the autonomy versus beneficence debate, demanding a nuanced approach.
However, is the risk of damaging a patient's autonomy worth the potential benefits? If we intervene involuntarily, are we not then responsible for ensuring that the intervention leads to a substantial improvement in their quality of life?
Arthur raises a crucial point about responsibility post-intervention. How do we ensure ongoing care and not just a temporary solution?
This ties back to the importance of a robust support system post-intervention, ensuring the patient is not just thrown back into the environment that led to the addiction.
And let's not forget the importance of innovation here. We need better strategies and treatments that make involuntary intervention a last resort, not a standard procedure.
Absolutely, Ted. The development of new treatments should focus on patient engagement and voluntary compliance, leveraging the latest in psychiatric research.
Neuroscience can support here by advancing our understanding of addiction, thus informing both ethical considerations and treatment innovations.
It's clear there's no one-size-fits-all answer, but this discussion emphasizes the complexity of involuntary treatment and the multidisciplinary approach needed to navigate these challenges ethically. Let's explore the integration of technology in addiction medicine. Mike, can you start us off with your perspective on technology's role in treatment?
Absolutely. The use of digital health tools like mobile apps and telehealth services has transformed how we monitor and manage addiction. It's not just about convenience, it's about effectiveness. These tools offer real-time data, patient self-monitoring, and personalized treatment plans that were not possible before.
I must jump in here. While the advancements in technology are promising, we cannot ignore the pharmacologic side of treatments. It's critical to develop drugs that can work in synergy with these technologies for a holistic approach.
I see both of your points, but let's not overlook the neurological implications. Monitoring brain activity through wearable tech could lead to breakthroughs in understanding addiction's neurobiological underpinnings.
That's an interesting point. However, technology also has the potential to improve psychiatric interventions. Especially when it comes to cognitive behavioral therapy, apps can provide patients with exercises and track progress outside the clinical setting.
It's fascinating to see how technology spans across different fields. Arthur, how do you see technology fitting into pain management?
Well, pain management can benefit greatly from these technologies, especially in preventing opioid dependency. But I have reservations about too much reliance on technology. It should augment, not replace, human judgment and the practitioner-patient relationship.
I understand your concerns, Arthur, but the aim is to enhance that relationship, not diminish it. We're talking about tools that give us insights we didn't have access to before, which can lead to more informed decisions.
And about enhancing, let's not forget the development of virtual reality as a form of distraction therapy. The results in managing pain and thus potentially reducing the need for opiates have been quite promising.
I must interject, Ted. While VR is promising, the neurobiological data that we can collect now through advanced imaging and other technologies is revolutionizing our understanding of addiction at a fundamental level.
All of these tools, however sophisticated, need to be applied within a framework that considers the patient's psychological state. Without addressing the mental health aspect, we risk overlooking the root causes of addiction.
It seems clear that while technology offers significant advancements in treatment and understanding of addiction, it must be applied judiciously. It's not a silver bullet, but part of a broader interdisciplinary approach. Any closing thoughts?
Just that as we move forward, the integration of pharmacology and technology holds great promise, but it requires careful ethical consideration to ensure these advancements truly benefit patients.
Agreed. The convergence of internal medicine, technology, and patient-centered care is where the future lies. It's about leveraging all our tools effectively.
Perfectly put. This conversation underscores the importance of an interdisciplinary approach, leveraging both technology and traditional methods to forge new paths in addiction medicine. Thank you, everyone, for your insights. Thank you all for such a stimulating discussion today. As we bring our roundtable to a close, let's briefly reflect on the major points we've covered, especially focusing on the interdisciplinary nature of addiction medicine in the future. William, would you like to start?
Certainly, Laura. Throughout this discussion, it's become increasingly clear that understanding the neurobiology of addiction is crucial. The points raised by Ted about the potential for new pharmacological treatments have been particularly enlightening. However, I must emphasize, without an integrated approach that includes both psychiatric and medical interventions, we're only addressing part of the problem.
I couldn't agree more, William. The psychiatric perspective, particularly concerning dual diagnoses, is something we cannot afford to overlook. Engagements like Ted's pharmacological strategies and Arthur's pain management techniques are groundbreaking. But let's not forget the role of environmental and social factors in addiction, a point Laura and Arthur have effectively highlighted today.
Yes, Tasha, the environmental aspect cannot be overstated. But moving forward, it's essential to think outside the box, especially concerning non-opioid pain management strategies. While TED's updates on pharmacology are indeed promising, we must be cautious and ensure these new treatments are accessible and ethically administered.
Access is key, Arthur. From an internal medicine perspective, the integration of technology in monitoring and treating addiction, as I mentioned, shows great promise. However, we must be vigilant to ensure that the human element of care is not lost. It's all about balance, and that requires consistent collaboration across all our disciplines.
Speaking of technology, Mike makes a crucial point about balance. The future pharmacological advances I discussed are only as good as our ability to responsibly implement them. William's insights into neurobiology have been invaluable here, highlighting the importance of a solid scientific foundation for new treatments.
Your points all underscore the critical need for an interdisciplinary approach in the fight against addiction. It's clear that while we have our individual expertise, the convergence of our fields is where real progress is made. Now, if there are any final thoughts?
Just to add, the future of addiction medicine certainly looks promising, but it requires us to be forever curious, constantly seeking better ways to integrate our knowledge for patient-centered care.
Absolutely. And let's not forget the importance of addressing the stigma associated with addiction. Education and empathy are as crucial as scientific advancements.
And with those advancements, ethical considerations must always be at the forefront of our practice.
Indeed, Arthur. It's about treating the person, not just the addiction. We must be holistic in our approach.
As we continue to make strides in pharmacology, let's collaborate with technology without losing the essential human touch.
Thank you, everyone, for such an engaging discussion. It's clear that through collaboration, innovation, and a dedication to our patients, the future of addiction medicine is bright.